I'm Simryn Atwal. I'm the founder of Bridge the Gap. For the youth of Surrey, one of the biggest things is mental health. If you look at things like socioeconomic level, immigrant background, cultural barriers, poverty levels, all those factors actually increase the rate of youth that are struggling with mental health. And those are all issues that kids in Surrey and in our community are dealing with. 1 in 6 kids in British Columbia are struggling with some sort of mental health issue, but 60% of those kids are not reaching out for services. The defining moment for me to get involved with helping with mental health was trying to access services for myself. I was dealing with a friend's suicide and I was wanting to reach out and talk to somebody. But the problem is that there's so many barriers in place. Finding help is tough. In my mind, I was like, well, if there's nothing out there, then I have to create it. So I started Bridge the Gap. There are people doing amazing mental health work across Canada. But if kids don't know what's out there, or if they don't feel comfortable enough to use it, they're never gonna connect with that service, and you're still gonna have that gap between kids that need mental health help and the organizations that are out there. We go into the schools and we give them that lived experience and that human connection. That human connection gets kids to reach out, and figuring out how to address it in culturally relevant ways was a huge breakthrough for us. We create this resource guide that helps them start their mental health journey through our workshops, our resources, our referrals. We've been able to connect with almost 3,000 youth in Surrey. It has been an amazing experience for us to see how many kids' lives that we've impacted and made even just a little bit of a difference in. That gap that we're addressing is universal, so expanding nationally would be the dream. What it means to me to be honored as a woman of worth is that our work and the idea that kids are struggling and that they need services to turn to, and this accessibility barrier is being acknowledged.